Next up, we're going to begin the panel discussion. And as they're coming up, I'll do the introduction so we can kind of dive right into it. We have a panel that's going to be focused on the impact of FDA regulation on diagnostics in oncology. And the full bios for the panelists are in your program, but we have Dr. Scott Gottlieb, who's resident fellow at the American Enterprise Institute, Dr. Michael Oncology, National Medical Director of Oncology Strategy for Aetna, Dr. Bruce Quinn, Senior Director at Fager BD Consulting, and of course Joy Lawson-Heidel, who we just heard from, President of the National Society of Genetic Counselors. Again, we have a couple folks roaming around with microphones, so if at any point in time you'd like to ask a question, please raise your hand. They'll bring a microphone to you. We would like to get this to be a little bit more interactive. But our format here, we have about a half hour, is really I'm going to pose some starting questions to the panel and to specific panelists, and they may interact with each other. They'll be happy to take your questions as well. I think it's exciting. We have multiple perspectives if you look at their background: practicing clinicians, those in insurance, those who have worked previously with the FDA, genetic counselors, and other perspectives as well. So Dr. Gottlieb, if I could, let me start with you. And I know in our kind of preparation call, you sort of raised the question of what should the FDA regulate, and you made this distinction between clinical utility and clinical validity. So maybe you can discuss that.
Right. This has been a multi-year discussion. We were talking about what we would do with the LDT test back when I was at FDA in 2003. So this has been going on for well more than a decade about whether or not FDA would step in to regulate some aspect of these tests. And I think the hesitation's always been around the question of what impact would it have on innovation in this space, because a lot of the tests that get developed locally by academic institutions, get deployed by physicians who are expert on these different platforms and are offered as services. And so there's questions of whether or not FDA has the legal authority to regulate these laboratory developed tests. And then the bigger question is what impact would it have on innovation? FDA clearly thinks it has a legal authority to regulate these tests. They will end up inevitably getting sued if they promulgate a regulation to try to regulate this space. And then there's a question of whether or not Congress would step in to give them clear authority and how that lawsuit would play out. But nonetheless, there is some questions around that. But the bigger question is, what are they going to regulate for? And right now, the agency is saying that they just want to regulate to try to assure the clinical validity of these tests. And by that, they mean if the test says it reads out a certain result, that it actually reads out that result. So it does what it purports to do. If it measures a certain blood serum level, it actually accurately measures that level. What the FDA has said more recently is that they don't want to regulate for clinical utility. And that concept means regulate to try to ensure that the test, when used in the clinical setting in which it is